Sexually exploited children are among the most vulnerable people in our society. Yet we're still not doing enough to identify and prevent exploitation from happening. Healthcare professionals need to be aware of the indicators of child sexual exploitation, then use their professional curiosity to explore whether intervention is needed.
Child sexual exploitation, more commonly referred to as CSE, which is what health professionals may hear more commonly, is a form of child sexual abuse. It's contact or non-contact with a child, and there are various models of CSE. So you may read in the papers about CSE rings, taxi drivers, employees, those sorts of things, but also there is the boyfriend model. A lot of research is focusing on sort of the teenage age group from about 13 to 15, 16, but I think we actually really don't know the true size of the children and young people that could be at risk of CSE. It can affect boys or girls. It's not relevant to an ethnic background or a religious background. It's pretty much any child or young person could be at risk of CSE.
Nikki was a victim of CSE for many years. The impact on her life has been devastating.
He was very violent towards me. There was many times when I tried to get away from him. You're cut off from everybody else, whether it be your family, your friends. My abuser got me involved in a lot of criminal activities, so I couldn't tell the police what was going on. I have tried to take my own life. I've got an eating disorder. It's affected my parenting. You know, the amount of damage it's done, and it'll never be undone. Healthcare professionals have the power to prevent a situation like mine ever happening again. That one phone call that I take a few minutes could actually save a child's life.
Children who are being sexually exploited almost invariably have contact with healthcare professionals. However, they rarely complain of the abuse that they're being subjected to. The following scenarios are all fictional. They'll help you identify indicators of CSE and recognise when they might be part of a more serious picture.
I need the morning after pill, please. We got a bit carried away last night.
OK, do you want to go through into the consultation room?
It's fine. I'm in a bit of a rush, actually. I've heard it all before. Can we not just fill the forms out here?
No, I'm afraid we need to have a talk in private. It won't take long.
This is ridiculous. I really am in a rush.
It won't take long. If you could make your way through, please. Thank you. So it's been 12 hours since you had unprotected sex. How old are you?
16. Well, 16 next week, actually.
Do your parents know you've been having unprotected sex? You really ought to discuss it with them, you know.
Tell my parents? Are you having a laugh? First off, they're not my real parents. They're my foster parents. And I can't tell them. This happened a couple of months ago and they went nuts. They said they'd kick me out if it happened again. Look, we're usually really careful. We made a mistake, you know, in the heat of the moment. I just need that, Ella thing. I can't have a baby.
Look, before I can prescribe you anything, I need to make sure that you understand the advice that I've given you. And you really should be
more careful. I know, I'm not a baby. Look, I've got the money, I can pay. Can we just hurry up with this, please?
We're nearly finished.
What a waste of time, just to get a pill.
Right, take that straight away. And I'd like you to read this, please. That'll be $34.99, please.
What? Yeah. There you go.
Nice phone.
Yeah, minting it. My boyfriend got it for me. Thanks a lot. I'm sure I'll be more careful.
This situation would leave many people feeling uncomfortable. But how many of the indicators of CSE did you see? Who is the older man with Claire? Why didn't she want to go into the consulting room? How can you be sure how old she is? She's taken the morning after pill before. Living with foster parents indicates that she is vulnerable. the knowing look to the pharmacist is inappropriate for her age. Why did the text cause Claire so much concern? Her boyfriend has given her an expensive present, and phones are often used to control victims. She clearly has easy access to cash for a 15-year-old girl, and why isn't she at school?
We wasn't aware that we was actually being groomed. We just thought these people were our boyfriends. But there was a lot of professionals that looked at it as though he was my boyfriend and I was just a naughty schoolgirl that wanted it. And what professionals need to be doing is asking children questions. You know, if they would have said to me, have you got a boyfriend? I would have said, yeah. How old is he? He's 24. And how old are you? I'm 14. So straight away, that should be acted on, it should be reported.
Professional curiosity is something that health practitioners have innately within them. If for some reason you feel uncomfortable or suspect that something is going on, it is your duty as that practitioner to ensure that you seek advice and guidance on the next steps.
Come. Hi, Claire. Been a while, hasn't it? 2 years, and look at you now. Well, we need to do your booster jab. You missed it last month when I was here.
I was off sick, kept getting tummy ache, but I'm better now, so they said I had to come back into school.
That doesn't sound too good. What was causing it?
Dunno, it just went away by itself. Sometimes I wish I still had it, so I didn't have to have stupid injections and do pointless exams.
Well, you might not like it, but I can promise you that diphtheria, polio and tetanus are far worse than exams. You don't have any allergies? Okay, pop your sleeve off for me, please. What are you going to do after your GCSEs?
Dunno. Moving in with my boyfriend though. He's promised to take care of me. But he doesn't give a damn about GCSEs.
How did you get that?
Oh, it was Kelly Carter. She was slagging my boyfriend off and I just wasn't standing for it. She's a right bitch. She won't be doing it again.
Well, you may be older, but not any wiser. Small scratch.
The school nurse is busy and frustrated by Claire missing her appointment. She also knows that Claire has been in trouble in the past. However, she may have missed a number of CSE indicators. What's the real cause of Claire's tummy ache? She seems to look very grown up all of a sudden. Those look like track marks that Claire was hiding when she was rolling up her sleeve. Could there be another reason for the bruising on her arm? And what's the real cause of her rebellious, disruptive behaviour?
I think for me, professionals would have been able to spot it quite easily. And what they need to be looking out for is changes in behaviour. You know, it could be a person withdrawing themselves, skipping school, gifts for markings, because I was beaten, you know, I had bruises and things. That's all things that they need to be looking out for.
It's unlikely when a child or young person is accessing services that they are going to disclose straight away that they are either suffering or at risk of CSE. Often children and young people don't realise they're being exploited. It's about building the relationship with the child or young person to gain their confidence so that they feel able to disclose to you potentially what's happening to them, and they're trusting you that you will be able to help protect and support them.
Hello? Miss? Can you hear me? Looks like you've had a good night. Have you been drinking, taking any drugs?
Hello, babe. Oh, I do like a man in uniform. What are you doing later? I could be your nurse. Would you take me home in your ambulance?
Is she alright? Well, it's safe to say she's overdone it, mate. Do you know her? Or what she's been drinking, what she's been taking?
I haven't got a clue. I was just passing. I was worried. I could see she was unconscious.
Nursey. You'd like that, wouldn't you? Well, give us some more slack, baby, and I'll do anything you want me to. Can you take a photo?
Yeah. Place your phone, I'll take it.
Yeah, gone from good Samaritan to smack dealer in 2 seconds.
She looks just like that girl we picked up. Do you know, outside the block of flats in the Dempsey estate last week?
Guess I best leave this one to the professionals, eh? Nice work, guys.
Well, she ain't got any ID on her and her phone's locked, but I mean, it's nothing a good night's sleep won't solve. Just worried about these cuts on her arm.
We'll have to take her in then. These kids don't know how much they cost the NHS with their binge drinking. I reckon we should charge them. Then they'd think twice before downing a bottle of vodka and a load of ecstasy.
Paramedics treat drunk teenagers regularly, and it's easy to think of them all as being the same. But remaining vigilant is crucial in spotting CSE. Why is Claire so inappropriately sexually aware for her age? Is Andrew all he appears to be? And why was he so quick to leave? Why was Andrew's photo on the homepage of Claire's phone? She's clearly drinking heavily and is taking drugs. The second paramedic has seen her recently, and she appears to be self-harming.
There were times when I used to slip my wrist just for relief, I think, really. It just feels like you're kind of getting a weight off your shoulders. I was provided with drugs and alcohol. So I think, any of those signs, a professional needs to be picking up on that.
What we need to ensure from a health perspective is that all staff are equipped to be able to recognise the indicators of CSE and when a child is at risk of CSE, particularly for staff working in emergency services, sexual health services, school nursing and GP practices and pharmacies, because these staff are potentially more likely to come into contact with children experiencing or at risk of CSE.
Hi Claire, how are you? I'm Rachel. What can I do for you today?
I need some condoms, please. I can't keep taking the morning after pill.
How many times have you taken it? And why are you having unprotected sex? It can be really dangerous, you know.
I've taken it 3 times now. I think it might be making me ill. I keep getting tummy ache, down there. It's there all the time. And it's really getting me down.
Have you been tested for STIs?
No. My boyfriend says he's clean and he doesn't want me to. He'd dump me if he knew I had an STI or couldn't have sex with him.
You really shouldn't be on your phone in here, Claire. Would you mind switching it off and putting it away? I really need to know that you're concentrating on
I'm listening, right? What does it matter if my phone is on or off? It's on silent.
I'm worried about you. Will you let us test you for STIs?
Look, I just want some condoms. I didn't come here for a lecture. If I'd wanted that, I'd have gone home.
OK, Claire. I know you're upset, and of course you can have some condoms, but you really need to think about being safe.
Yeah, and here's another leaflet. Again, just give me the condoms, will you?
The clinician is finding it hard to remain patient with someone who doesn't seem to want to help herself. CSE victims can be very challenging, so you should see this frustration as an indicator in itself. Why is Claire's self-esteem so low? What's the real cause of Claire's pain, and why isn't she getting it treated? Why is the phone such a big issue? Could there be someone listening in? Her moods are swinging alarmingly quickly, and she appears to be unstable and very vulnerable.
There was a lot of occasions when I'd use that phone so he could hear everything that was going off in the rooms. When I was 14 and 15 and being abused, I was an absolute bitch. I went from this young girl that was confident but kind, polite, had manners, to all of a sudden wanting to kill anyone that came near me. And I think professionals, when they see this naughty kid and, a kid that they can't handle, it's easier just to say, oh, do you know what, I can't deal with this, and walk away from it. And you can't do that.
It can be frustrating to a frontline practitioner if this child or young person is continuing to present and not listen to their advice or take on board their support. It's our role as health practitioners to see beyond that stroppy teenager and actually see the child and young person behind that and what's causing that behaviour.
If you're concerned about a child you're treating, you must contact your local safeguarding team.
To my knowledge, in the UK, a professional has never lost their job for reporting child abuse, but there's been many that have lost their jobs for not reporting it. If somebody would have spotted it earlier on, it could have prevented such a lot. I wouldn't have had the sexual and physical violence of things. My family wouldn't have been ripped apart. I would have had an education. I wouldn't have an eating disorder. My entire life would have been different.
If you're dealing with children as a healthcare professional, always remember the child and look beyond their behaviour. Consider why they're behaving like this. Always listen to what the child is telling you. Don't dismiss what a child does tell you. Be professionally curious. If the situation doesn't look or feel right to you, then it probably isn't. If in doubt, always seek advice and support from your line manager or safeguarding lead. And share information.